Good afternoon. It is 3 o'clock on the dot, so let's get started. In the event a fire alarm sounds, please remain in the auditorium and stay seated. Should there be a need to evacuate, a Springmore staff member will direct you on how to leave in an orderly fashion. Please remember not to use the elevators, and where do we go?
Red pole.
Red pole, thank you. To the red pole. Thank you all for coming this afternoon. You are here about the pharmacy seminar, and I'm going to turn it over to Brandon Hare.
She doesn't look like a pharmacist to me. I know. I'm not near smart enough to be a pharmacist, and I promise I won't. I promise I won't be long. But I just wanted to give a little background on how we got to this and kind of continue where we left off Friday. We had our dedication to Dr. Edmondson for the clinic. You know, we named it after him, and then we're going to roll into having our in-house pharmacy. And when we envisioned doing the health center renovations, a huge part of that was providing services for each of you as independent living residents as much as renovating the health center. And the idea is to bring all of our outpatient services together in one close area with outside of the health center. So if you remember in the past, the clinic was in the health center, had to go through the locked doors. Therapy was in the health center. So all that you had to go into the health center to actually receive those services. Well, we know that most independent folks use those services as much, if not more, than the skilled nursing folks. So we wanted to bring it all outside. So, as you know, the clinic is now where the offices of the the health center staff used to be. So now we've expanded our clinic; it's more accessible. Down the hall is our physical therapy and occupational therapy. Again, much easier to get to, and right on the same hallway. And then once it's open up those doors where they've been locked for years, and you press in the code to go in and out, that will be all opened up. And over to the left, where the old clinic used to be, will be our in-house pharmacy. So we want to, again, kind of keep in with the theme of trying to provide as many choices and options for residents here as possible, so you don't have to leave Springmore for hardly anything. You know, it's kind of very similar to the store. You know, we have our community store that's very popular that Mr. McGaffin did. I saw Mr. McGaffin walk in a second ago. It was a huge part of that, and it continues on today. And I just heard so many people say that got them through COVID. I mean, they were able to get everything at the store during COVID. So we want y'all to be able to have services like that where you don't have to go off campus, or very much as least as possible. So that's something we envisioned a while back, and it's finally coming to life. I've been able to speak to one other community in North Carolina, in Hendersonville, called Carolina Village, and they have an in-house pharmacy. They've had it for about 9 years now, and it's very well received. About 50% of their residents, their independent residents, use that, which is about 190 to 200 residents. So if we have 50% of y'all using it, that's about 225 people. So that would be very well received. The other thing that's really neat is that we're going to make this available for our employees as well. So that will be a nice benefit for our employees to be able to use that pharmacy to refill prescriptions instead of having to go down the road to CVS, or just get it when they walk in or get it when they leave. It will be a nice little another extra perk and a benefit for our employees. So that is kind of the vision behind it. That's how we kind of got to where we are now. I'm going to introduce Richard Settle. He's going to tell you a little bit about how he's involved with the pharmacy, and then we're going to have the two ladies, both Sarah and Haley, that y'all may recognize from Medipack. They're the ones who've done all of our COVID vaccines. So if you remember, we got those late 2020, before everybody else got them. They're the ones that's responsible for that. So just give them a little quick plug that they still do our COVID vaccines. So they'll be talking in a minute to kind of describe exactly how the pharmacy will run. So if you have any questions afterwards, I'm here, and a couple other staff members. I know that Brad's here. He's been helping with the construction. So Richard, why don't you come up?
Hey, everyone. I'll probably be speaking even shorter than he is, but right now I'm Springmore's representative that will be interfacing with Medipack and the pharmacy. I also work directly with Legacy in our physical therapy, and I'm also managing the home care department that we have here at Springmore. My goal, I guess, over the next year as we're developing this is to work with Brad to make sure if there's any questions or any abilities or issues he has with the build, that I can assist him in any way as possible. I'll also, any questions that you guys have as we go on through this process, because I know there's a lot of questions for them today and they're going to have most of those answers, but some of the things like I know hours have not been developed, but I'll be the Springmore representative that will try to keep you guys informed either through a message through the resident memorandum or maybe on the portal as some of those questions start to get answered as we get closer to that development. Feel free to reach out to me. My extension is 7063. If in the next few months you want an update, feel free to give me a ring. Like I said, I'll try to give updates through the residence memorandum or the portal. But in that meantime, what doesn't get answered today, if a question does come up, please reach out to me, and I will reach out to our friends here at Medipack and see if I can get an answer on that. But I just want to let y'all know that Sarah and Haley are very nice people that I've worked with Sarah for years, and I'm very excited to see this come together. And I'm going to let her tell you what's going on next.
All right. So as Richard said, my name is Sarah Wiesner, so I'm the clinical director for Medipack Pharmacy. So I have gotten the pleasure to get to see quite a few of you when we have done the vaccinations for you guys over the last 4 years. I also wanted to take a second, and introduce Haley Webster. So Haley Webster is the consultant pharmacist for the healthcare center. So she reviews all of the records. She works with the providers and the nurses over there. She will be the pharmacist that will staff the pharmacy once we get it up and running. So she will be able to really provide a good continuum of care. So she'll be able to know you guys and then carry that all the way through to the health center. So you'll see her a lot in the very near future. I just kind of wanted to go over and give a general overview of who we are, what Medipack is, and what our goals are with bringing this pharmacy to you guys. We're really excited to be able to partner with Springmore on this. So Medipack Pharmacy, we're family owned and operated, and we service retirement communities and nursing homes. Okay, so that is pretty much our model. This particular pharmacy will operate like a retail pharmacy, just like a Walgreens or a CVS or a Harris Teeter, but it'll be a lot smaller scale, and it'll all be family owned, okay? We are based out of Winston-Salem, North Carolina, okay, and we have been around since 2004. We service roughly 4,000 patients across the state of North Carolina, all right, right now. So we're looking to expand that with you guys. We will be able to offer set hours. I know that's what everybody wants to know is what are our hours going to be. We do not know that yet. A lot of that will be driven by the volume in which we will, that will help determine. Volume will help determine what our hours are going to be. Sorry, I'm tongue-tied today. So basically, if we only have 50 of you that are using our services, that will be decreased hours. If we have 200 of you that decide you want to use Medipack, we obviously will offer expanded hours for those pharmacy services. So that's kind of how we'll drive that, is we'll get, over the next 6 months, we'll kind of start to get an idea of how many of you are interested in using those services, and we'll be able to get a better answer for you guys so you know what the hours will be as we get closer. But I don't have the answer for that today, for what our hours will be. One thing I know that's also on everybody's mind is going to be related to cost and insurance, okay? And so I want to take a second and go over that. Basically, insurance dictates what the cost will be. So since we will be operating as a retail pharmacy, our cost to you will be the exact same as it would be if you carried a prescription into any other retail pharmacy. Okay, so the cost will not be different. So if you take your prescriptions right now to Harris Teeter, we will be the same price as Harris Teeter, same price as CVS, Walgreens, any of them, okay? Where we will not be the same, and this is because we can't, is mail order. So let's say you have CVS Caremark. CVS Caremark owns their own mail order pharmacy. If you use mail order and you're getting your generics for free, that insurance company will not allow us to give them to you for free. Okay, it is still a reduced rate, but the insurance company only will give it to you for free if you use their mail order pharmacy. And I just want to be very transparent with that. The benefit for us is you'll be able to come in and get transition fills. You can use us for short-term orders if you do continue to use mail order. So it's not that you can't use us for anything else, but I do want to make sure everybody knows that. Okay? A lot of you have questions when you go to check on your Part D plan on whether or not Medipack is contracted with that Part D plan. And I'm going to try to explain this to the best of my ability that it makes sense. We are contracted with every Part D plan. Okay, we are contracted with every Part D plan. But because we're not a big giant like Walmart or Walgreens, we go through a middleman to make those contracts with those insurance companies. So when you search Medipack, you're not going to find us on CMS's website, okay, when you're going to try to see if we're contracted, because we have another layer in between CMS and us, and that's what stops that. But we are contracted with every Part D plan, okay? So if that helps you alleviate any concerns, as we move closer, we will have billing representatives that'll be able to help you if you have specific questions. I'll be able to help you. Haley will be able to help you if you have specific questions. But we are contracted with every insurance plan, and if there is one we are not contracted with, we will contract with them. So there should not be any insurance that would be an issue, okay? Yes. Yes, ma'am. Yeah, federal plans as well. So that was federal plans, TRICARE, all of those. Obviously, if you get your medications through the VA, we obviously will not be able to compete with that, but we can fill for TRICARE as well. Okay. So we basically are hoping with this that we can come in and we can offer you guys the prescription services, of course, so you can get your medications, but we also want to make sure you have access to a pharmacist. And Haley is a wonderful pharmacist. She's a wonderful clinician. She would be able to help you do medication reviews, take a look at everything you're on and make sure it's all working well together. She might have recommendations that you could take to your provider that might help you with certain disease states. She'd also be somebody that can help do one-off vaccines for pneumonia and things like that. So she's really going to be a full picture clinician for you, not just a place you go and get your prescriptions, but you're really going to have access to a pharmacist that can help you with your medications and your disease states. Okay. Does anybody have questions that are hopefully I can answer? We'll start here.
Presently, my prescription provider tells me what stores I can go to. I've been with Aetna, and I used to go to Walmart. Now I'm on another plan of Aetna, and they're telling me that I have to go to Harris Teeter. So, do you handle that? I mean, what if your name is not on that list, then you won't give me the same prices that I would get going to the other places?
So her question is related to her insurance plan, dictates which specific pharmacies she can go to based on what's in network and what's out of network. So we would honestly have to take a look at that individually. And a lot of times what we see is, and it depends on what you're on, so this would have to probably be an individualized conversation. There are plans that have in-network pharmacies, and then there are plans that have, you can go to any pharmacy. So we would have to check plan by plan to see what that would look like, and then also we can look at what the cost would be. So oftentimes, if you're on a lot of generic medications, our cost is cheaper than it is to run it through your insurance. So we would just kind of have to take a look at that, and which we will be happy to do case by case to look at it and make sure that it's beneficial for you. Mm-hmm.
Medipack's website indicates that infusion therapy can be part of what you provide. For us, will that be one of the services that you can provide?
So her question is, can we provide infusion services for the independent living setting? We would work with Charlotte and the clinic. We absolutely can provide those infusion services. That would actually come out of our Winston-Salem location. We have a certified clean room. So that is something that we absolutely could do. We would just have to work with the clinic and home care in terms of how you would be getting that particular infusion. She asked on the generics, how can I be cheaper than zero? I can't be cheaper than zero. I can be cheaper than a copay sometimes compared to an out-of-network. Yeah, we can't legally give you the generics at zero because we don't get reimbursed like that. That's only those mail order pharmacies that can do that, unfortunately. Yes.
I currently have 3
Yeah. So her question is basically if she has prescriptions at 3 different places, and she wanted to know if I would be able to kind of take a look at that and do a cost comparison and see if it would be beneficial for her to move her prescriptions over to Medipack. We absolutely can do that. And I think one thing to keep in mind with this is also, we want this to be a convenient service for you. So there might be times, and it's up to each individual, but you might decide that, okay, yes, it's going to cost me $20 more a month rather than using mail order, but I can get it all here local, and I have access to one person that is going to monitor all of my medications, and we're happy to do that. But we're happy to do a cost out for anybody and kind of evaluate what it would look like for you so that you know exactly what you'll be dealing with. Yes.
I think that I got medication from you when I was in the health center, and it was encapsulated in plastic. Do you have, I want them in a bottle.
Right, yes.
You have that too?
Yeah, so when you get your medications from her question is when she was in the health center, she received her medications in what we call blister packs or bingo cards. And then she wants to know if that's how it will be dispensed for the Springmore pharmacy. So the Winston-Salem location, we are a long-term care pharmacy, and we have to package those in that format to be convenient for the nursing staff. That is not how it will be packaged coming out of this retail location. We actually will have a variety of options, and we plan, when we get a little bit closer, I'll kind of bring some of those in so you can see what they look like, but we absolutely will have pill bottles.
Do you do automatic refills?
She asked if we would do automatic refills, and yes, we will do automatic refills. We will also offer delivery. Okay, so we will have your things that you're on all the time. We can do automatic refills and deliver them to your door. Yes.
Is blister pack an option for independent living?
Yes, the question is blister pack an option? It absolutely is. So we can do individual blister pack, or we can do what's called multi-dose blister pack that will put all your morning pills together, your afternoon and your evenings. We're also going to explore some options related to pill boxes that are mechanized, that basically will pop open when they're due, and then you would be able to bring that pill box in, and Haley would be able to fill that for you. So we're going to offer a variety of options. Yes. A patient portal. Will we have a patient portal? Yes. So we will have a way that you can go online to order your refills. You can see what your bill is. You can pay your bill online. We will have that. Yes. Yes. We are hopeful for third quarter. Brad, am I lying on that? Yeah. And what will happen for us, just so I'm being very transparent, is the way licensing for pharmacy works is the construction has to be completed before I can apply for the license. So once the construction is completed, at that point we apply for the license, and they're pretty quick. They'll come out, they'll do an inspection, they'll make sure that we're up to snuff on everything. We've opened quite a few pharmacies, so I don't foresee any issues with that. So probably within 60 days of construction being completed, we should be open.
I know there are a lot of specialized medications that people take, but there are also some more general ones. And like if we saw the doctor on Friday afternoon with a really bad cold and cough and needed the Z-Pack, will you have those kind of things on hand that you could just?
Yes. So the question is basically, will we have your typical inventory on hand to be able to take care of the needs when you go see the provider, whether it's in the clinic or outside? And the answer is yes. So we will basically keep what we call kind of the top 300 or top 400 medications on the shelf at all times. And then we will also keep what you guys use. So if you are using us, that will be the inventory we keep on hand. The benefit for partnering with a pharmacy that also has a long-term care pharmacy is we already deliver to the health center twice a day, 6 days a week, and on Sundays we're on demand. So if it is something that was not stocked and Haley couldn't fill it for you, we could get it in and still get it delivered to you by that evening. Yeah. Yep, so that's.
Associated equipment, like some of these monitors some of us use, that as well?
So the question was like more kind of associated equipment, like DME type of equipment. And yes, so the short answer is yes, we are working through exactly how that will look. From a diabetic standpoint, if you're talking about your blood glucose monitoring, absolutely those will be available. Lancets, strips, glucose meters, all those types of things will be available that you can order through us and we can provide for you. We also have a sister company that is a DME company, so we would be able to have some opportunities there. I'm not going to say that we're going to be able to keep every single thing on the shelf. It is not a huge space. But again, with our delivery systems, we should be able to get something to you within a day. Okay.
What is a DME?
So they're medical equipment. So any like canes and things like that. Diabetic supplies, those types of things. What other questions? Yes, ma'am.
So if we get a prescription on Friday afternoon, would we call you and it'd be in a recording and how are we gonna work odd hours?
So it'll depend on how your provider does the prescription. So a lot of providers like to send electronic prescriptions, which is what we're used to. So we would get that e-prescription into our system. You would be able to call an after-hours number, and then we would be able to fill that. And then just based on, and that's something we'll have to kind of tweak as we figure out what our hours are going to be. As to when you would get that medication. But you would have a voicemail option, an email option, and then the e-scripts can be sent at any time. And we'll also have a fax line, so they could fax prescriptions to us as well.
This is probably an easy question to answer, but if I choose to use you and I have to go to the health center, that would, I would assume, make a very easy transition for getting the right medications at the right times and all that kind of thing.
Yes, so her question is if she's using us in the IL and has to go spend some time in the healthcare center, that should make for an easy transition, and the answer is it absolutely will. And the other thing that I'm very excited about is Haley will be a big part of that continuum because she actually reviews every chart in the healthcare center every month and looks at every new admission. She also would know you from the independent living side, and we would have access to all of that. So then when we see you come back from a hospital stay, we'd be able to say, hold on, we're missing her eye drops. Where'd they go? It would make for a very seamless transition. Plus, the bills all look the same. Everything would be a similar process. We'd already have your payment info on file. So yes, it would make it very seamless. I'm going to let you advertise for us. Yes.
Will all the employees within the pharmacy be under y'all's heading and be a contract through you?
His question is, will all the employees at the pharmacy be under Medipack? And the answer is yes, because there does have to be a pharmacist of record, and that pharmacy manager, which will be Haley, will be responsible for the employees. So they will be contracted employees. They will be Medipack's employees that are dedicated to Springmore. Yes?
How about carrying any small number of over-the-counter supplies or medications?
We're definitely going to have OTC medications available for you and some of your basic, kind of sundries that you might need. So we will definitely have that. Volume of what we have will be dependent on space, but the benefit too is we keep all of that in stock. We will basically have a separate part of our warehouse in Winston-Salem that will house extra stock, and we'll deliver that every single day to the pharmacy. So we should be able to make sure that we have whatever you need. As we move closer, we'll be actually asking for you guys to give us some ideas of things that would be beneficial for you to have. We do not want to compete with the store, but we do want to make sure anything you need from a medical standpoint we can have on hand. Any more questions? Oh, yeah.
If you have supplemental insurance, drug insurance, how is that incorporated into what you're doing?
So we would be able to basically use that supplemental insurance and apply that towards your medication.
Billing, you would handle all that and the amount that would be charged to the person?
Yes, yes, ma'am. It basically goes through both before you get a copay.
When I go to sign up for Medicare Part D, how will I know your price compared to what I see on the website?
So as long as we are contracted with all those plans, and insurance is insurance. So the basic way I can answer that is if you see that a Walgreens price is $4.82 for your lisinopril, that's what the insurance is going to dictate that we charge you as well. Yes.
Am I correct that your efficiency in service is somewhat related to the number of people who join this? So if we have 50, the hours may be shorter. If we have 100, the hours are longer, the service is better. So we should encourage us to do this.
For anybody that didn't hear that, that's the most important thing, though. But yes, so his point is that our hours and our offerings are going to be tied to how many of you choose to use the services. We're very passionate about this. I really do think it's going to be a wonderful asset for Springmore. But absolutely, you should go and tell every single person that the more people that do choose to use Medipack services, then the more we're able to offer you. Because we would love to be here 5 days a week and be available for you for good extended hours. But that is all going to be dependent on volume. Very good point. What other questions does anybody have? Yeah.
If a prescription times out, as far as from the doctor's concerned, will you be responsible for contacting that doctor to re-prescribe that?
Yes. Yes, so his question was, if you run out of refills or a prescription expires, will we reach out to the provider to get a refill? And the answer is yes. So especially if you're doing our automatic refills, we already have systems in place. When we fill your last prescription, we request a new one so it's there ready for you. Same thing with any controlled substances you're on. We'll manage that as well. The question was, do we have a monthly premium? No, ma'am. There's not you don't pay a monthly cost to utilize us. It's just your copays for your prescriptions.
Hopefully I won't have to use it with you all. Will you plan to stop narcotics?
The question was, will we plan to stock narcotics? And absolutely, we will stock anything that anybody's on, and then we'll have a small amount of everything else. But again, if it's something that an order came through and we don't have that item, as long as I place my order by noon, I have it in by 5 o'clock that day. So we will make sure we have what you need.
So memory pills will be stocked?
Yes. They're going to be out in a bowl. Memory pills will just be out on a bowl on the counter like mints, and everybody can come and take them, including me. Yeah, it depends. Yes, ma'am. Did you have a question?
Yeah. Presently, the packaging from the pharmacy is not accepted. When one goes into the clinic, a different packaging has to be used. Is that going to be true with the use of Medipack?
Health center. So when you go, so her question is, will you have to use different medication when you go into the health center? And the answer to that is still yes, because of the packaging. They need it in the bingo cards when it's in the health center. But we would be able, if you already have yours in the independent living side in bingo cards, then that would be absolutely fine. If you're using pill bottles, they could use that until we could get another supply sent out. And we can kind of work through some of those kinks. So her question is, can we repackage into bottles? And I wish I could tell you yes. In North Carolina, it is illegal to repackage, unfortunately. But there's a couple of things we can do with that if that presents itself. We just can't take your medication, repackage it, and resell it. But if you brought your card in and Haley was filling a bottle, she can help you put those in there. That would be fine. We just can't charge anything for that. I agree. Yeah, you don't want to have a bottle and a card because I don't want you to take both. What other questions? Yes, ma'am.
The best way to check to have our coverage of insurance to make sure that this is going to work.
So when we get a little bit closer, I'm going to actually have everybody kind of fill out a little intro form if you're interested, and I'll have our billing department just verify that your insurance, that we're contracted, we accept your insurance, so that you know that going in.
Sarah, did you want to mention the recycle?
Oh, yes, good point. So another thing that we'll be able to offer you guys is whether you get your medications from us or not, if you have something that expires, you're no longer taking, you will be able to bring that into the pharmacy and we will be able to destroy that for you, okay? So that way we make sure, and we already have contracts set up on how we do that, and we do that through a confined incineration. So we do have a burn contract with that, so it's not going into our water. Yes?
Will you do that for sharps too?
Yes, I don't see why we can't set up a pickup for sharps. Yeah. Will you write that down for me though? Like if you are a diabetic and you give yourself shots. So they go in a special container. Yes, so we should be able to handle that for you. Yes, so for everybody that's in here right now, by show of hands, can you tell me if you're interested in using the pharmacy? Okay. Now go tell all your friends.
And another, I mentioned earlier about the employees using it in day one, that will help with the hours as well. So if we offer to our 480, 500 employees, and we have 100, 150 people take advantage of that, that's going to help as well.
Yes.
So it's kind of a joint effort to see how much business we get, to see how much you're going to get to see Haley here. But we will have hours, again, like Sarah said, we just don't know the amount until we see the demand. It's going to be a supply and demand, product that we provide. But again, it's a boutique thing, more so. It's something we provide here. It's really no different than the clinic. You can use us if you want to, or you can stay with your provider. Transportation, you can use us. You can drive yourself. Personal training with Carrie, you can do personal training with her. You can go to a gym. So it's this convenience of having it here on site, and so that's what we're trying to provide y'all, just a convenience, and also very cost effective and fair. But there'll be some things that we just obviously can't do by being a big house pharmacy, but should be pretty close, as Sarah said.
When you reference billing insurance, are you talking about the Medicare Part D that we sign up for?
Yes, ma'am. So she asked if when I'm referencing billing insurance, am I referring to Medicare Part D? And the answer is yes. Yeah, we bill all Part D plans, and we're contracted with almost every commercial plan as well. So we're very, very excited. We appreciate this opportunity. We're really looking forward to hopefully getting to work with a lot of you guys. We will try to offer, as things move forward, probably closer in the spring, we're going to do a brown bag event where we'll offer that you can bring in any old medications. And at that point, we'll start looking at signups and getting some information from people that are interested. So this won't be the only time you see us. I do want to make sure that we get out in front of you and we are able to answer any questions that you have. But in the meantime, anything you have, if you take it to Richard, he knows my cell phone number and my email. He'll make sure that we get your questions answered to the best of our abilities. Okay? If there's no more questions, I really appreciate your time. Oh, you got one?
One other question, and that
Yes.
will you have any capacity to be able to get your refills on basically the same time?
Like to get them all stacked where they're all on one day? Yes.
And when you go into the nursing care for just a week, it really shoots you down. So you get a bucket full sometimes based on what the doctor's ordered.
Yes.
You shoot them too.
Yeah, we can do that. We can get you on a set cycle, and it'd actually be even easier for Haley that way too. So we definitely can do that. Well, again, thank you guys. I really appreciate you taking the time to come out and listen to us today.
Thank you.